health experts. I'm here now with Dr. Marlene Welch. She has been on our show several times before, and we've talked about some different things, like tummy tucks, and I was so distracted by the tummy tuck talk last time that I can't even remember what else. But we want to talk today about injectables, because I think there is a lot of confusion what an injectable is. Is it just Botox? Is it, so let's describe first what constitutes an injectable.
So it's amazing that Botox has become a very generic word for just about anything that's an injectable. So I like to classify them into two different kinds of categories. An injectable is Botox or Dysport, which are really toxins, and what they do, well, I shouldn't say botulinum toxin, people get nervous about it, but it really is an ingredient that softens the lines in your face by paralyzing the muscle in the face. So the frown lines are caused by the muscle underneath contracting, and if you soften those lines by weakening the muscle underneath with Botox, then that helps with the appearance of the lines and wrinkles. Now, those are one category. The second category is filler. So we always talk about the smile lines, and that's the classic example of where people want to put a filler, but the other place to put it is in the lips, for example.
And there are a variety of places. Let's talk about the different things we can do if we come here to Faces. I'm going to come to you. Let's just make it a personal story about me. I'm going to come to you and look old like I do. What are the things that you can do to help age, help the product of age, I guess, that happens to our face?
So I like to start from the surface, and I'll let Angie Scott, the esthetician, one of the estheticians here, talk about skin, which is where we always like to start. So there's also all sorts of skin products. And then you can start with the lines and the wrinkles on the skin, which can be affected by the Botox that we were talking about. And then when you have more deeper folds, you can start using filler. And then as we age, we actually start to lose the volume. So when you think of a young face, you think of a full face. You think of your baby face. That's right. And actually, as we start getting older, you lose a lot of that. So some of the more recent fillers actually start to address just the volume and start to bring the fullness of the cheeks back and the fullness around the temples back to bring back that youthfulness.
Well, we're going to talk in depth a little bit about Sculptra in just a few minutes, but let's talk about right now. So let's say I come in to you and I want to get rid of some lines. Right here, everybody, everybody gets those little crow's feet, right? Isn't that what they're called? So everybody gets the crow's feet right here. What would, obviously every individual is different, but in general, what would you suggest for somebody who would come in?
So I will always start looking at the whole face, but around the eyes, it's a classic place for Botox, and I just have people smile or squint as tight as they can, and depending on the severity and how many lines they have, it's usually somewhere between just 3 or 5 injections around, and just with a few injections around the eyes, it will really soften the wrinkles when you smile.
So how's the process work? Do I need to come in first for a consultation?
Yes, you do. You have to come in first for a consultation, and like I said, I'll start with the skin. I'll do the overall picture, and I usually like to ask people what bothers them the most, because I don't like to be very prescriptive with people, because I'm more interested in asking you what it is that's bothering you when you look. I'm more than happy to go over the whole picture, but if people are mostly interested in around their eyes, then I'll treat what they're most concerned with.
It's important, I think, and you have talked about this before, that you make sure if you're having a procedure like this done, that somebody is qualified to be doing it.
Yes, I'm always a stickler about the board certification, and I think the thing that reason why I like to emphasize that is because Botox is one thing you can use for rejuvenation of the eyes. But if someone is focusing on the crow's feet, but what's actually causing their aging is maybe a drooping of their eyelids or their eyebrows have dropped, and what they probably could get the best result from is eyelid surgery or a brow lift, then someone who's not a board-certified plastic surgeon or an oculoplastic surgeon or a facial plastic surgeon can't give them that full spectrum to give them that full consultation to let them know. And sure, they might look a little bit better addressing their crow's feet, but they aren't going to get the best result.
You really
just
get
that.
to the bottom of what
Yes.
the problem is.
Yes.
Which, look, if I'm putting something in my face, I want to make sure that that's what I should be doing. I don't think anybody wants to have lots of procedures done. If I can
Correct.
do it with less, fantastic. If somebody calls and makes a consultation with you, what kind of, I think a lot of people want to spruce up for summer. You know, it's that time of year where we want to look better, we want to look fresher. What kind of time frame are we talking about?
I can usually get people in within a couple of weeks, and certainly the Botox will take effect within 3 days to 7 days.
And that procedure of Botox, of coming in and having the Botox done, I mean, am I here for a couple hours?
Oh,
How long does it
no,
take?
it's half an hour at most.
All right, and so that means you could have several things done. See, look,
Yeah.
see how I think? I like to put things in time perspective so I know
Yes.
just what I can do while I'm here. Well, we're going to talk more about Sculptra, which is
Yes.
an injectable, a filler. We'll talk about that when we come back. We'll be right back on Better Living. Well, we are back here with Dr. Marlene Welch at Faces Skin Health Experts, and we're going to talk about Sculptra Aesthetic. We kind of briefly mentioned it a minute ago, but let's explain to people what it is.
So Sculptra is a new form of injectable. It is not really a filler, but it does ultimately result in the same kind of effect as a filler, but in a much more subtle way, and that's what is so unique about it.
I love it because, look, if I'm having something done to my
Yes.
face, I don't really want people to know that I'm having something done to my face.
That's right. And so with a filler, you get an immediate result. So if you have something done to your face, like if you have, you know, the smile lines filled in, you're going to leave the office and it's going to be an immediate change. So people are going to notice. And that's okay with a lot of people. They want to see that change, but some people would prefer to have a more subtle progression and a more subtle improvement in their appearance. And that's the advantage of Sculptra. The procedure is done in a series. So you
Okay.
do it once every 4 to 6 weeks. And if you take pictures and you follow someone's progression with these, the first to the second, you don't see much of a change. Maybe the second to the third, you're seeing a little bit more. But if you look at the first and then the
Right.
fourth, it's just so dramatic. And that's the advantage. It's sort of just subtle improvement over time.
Let's, we've got some pictures to show. If we put those up, these are some examples of people, and it definitely happens the way you said it did.
Yes.
Not a huge difference in the pictures when you compare 1 to 2, 2 to 3, but if you go 1 to 4, it's remarkable.
And the thing that's also wonderful about it is that with the other fillers, you're actually putting a product in that's going to be broken down. And so you will have to come back in 9 months to have it put back in again. So Sculptra is unique in that it is something called poly-L-lactic acid, which is a very commonly used substance that's actually in sutures. So when I put a suture in that's an absorbable suture, it's the same material.
Okay.
And what it does is it causes your skin to make more collagen. So when you put this material in under the skin, it actually induces your own collagen formation. So as you're improving, you're actually causing your own skin to thicken itself, and it lasts over 2 years.
That is great news. And look, if I'm going to do something, I think I would much rather be rejuvenating my skin. I mean, literally rejuvenating it rather than just filling it with things.
Yes.
It seems more natural.
And that is why I love it. This is probably the thing I'm doing the most is Sculptra recently, because I really have seen just amazing results with it. Now that said, it isn't everything.
Right.
So you can't use it in lips, you can't use it under the eyes. So there are obviously still places for filler. But in terms of a very subtle overall rejuvenation that lasts a long time, Sculptra is amazing.
Who is it good for? Okay, so you've told me before I kind of have a lean runner's face.
You do.
It's good for somebody like me, I think.
Yes.
But who is a prime candidate for Sculptra?
So in 2009, the actual FDA approval is for around the mouth, so nasolabial folds, the smile lines, around the mouth and around the chin, and that is where you can see in those example pictures, you're
Right.
seeing the greatest improvement. But, you know, in sort of off-label use, there are other places you can use it to just increase the thickness of the skin and improve the fullness of the face.
So it doesn't really matter what shape your face is.
Correct.
It's just if you have those very deep lines. It means I've laughed a lot, right?
Absolutely,
That's,
absolutely.
You showed me a picture earlier, and it was this woman who was 63 years old. Oh my goodness, she didn't look. I look older than her, and I'm 20 years younger than her. She looked 25 years old. It's remarkable to me what the product can do. So let's talk about. You said it's a series of
It is a series.
visits. How long does each visit take? Can we schedule them, in times that are? Can you do them during the day? Can I come do it at lunchtime and then go back to work, or am I going to be in some pain?
So I like to schedule about an hour for people.
Okay.
I do want to put a topical anesthetic on, which will take anywhere from 10 to 15 minutes. The biggest risk with Sculptra, because we are injecting a little bit deeper into the skin, is that there is a significant risk of bruising. So I would say I wouldn't plan to go back to work in case you do get a bruise. So you can camouflage it, but it's one of the bigger risks, especially because it's more of a global injectable. There are a lot of places I'm going to be putting the filler, so there is a higher risk of bruising. But I'm here 2 days a week, so I'm here during the day on Tuesdays, and I even have evening appointments on Fridays. So if you would want to come in on a Friday night and then have the weekend to recover, that would be a good way to do it.
That makes a lot of sense. Or you could take the day off. I have no issues with that either.
Sure.
Take the afternoon off. That makes perfect sense to me. And how quickly, let's say I have it done on a Friday, I realize it is a gradual, but will I see some results right away?
So initially, you do see some results just from the volume of there's a lot of water that goes right in your face. So right away, it looks like you're fuller, but a lot of that gets absorbed over just the next couple of days. And some people will see some change between the first and second, but most don't. You usually will start to see the results between the second and third and the third and the fourth. And then over time, as you're making more collagen, then you see the results progressively over the next couple of months.
You said, I think I remember the date 2009 that you just said FDA approved. So this is fairly new to the market.
It's fairly new, and actually you can only board-certified plastic surgeons and board-certified dermatologists are actually approved to use it. So there's a training that goes along with it, and not anyone can use it.
Which is a good thing.
Yes.
You have sold me on why it needs to be a board-certified plastic surgeon doing any of these procedures on your face. So I assume this starts the same way. You come in and have a consultation.
You come in and have a consultation, and I can assess globally whether Sculptra or whether any of the other products that we use. We use Juvederm, we use Restylane, we also have Botox and Dysport. So it's a global consultation on whether, and I'll decide which of these products are best.
All right, I think that's a consultation I need to make right now. Hey, stick with us, because coming up next we're going to talk about skincare, and that's definitely where it all starts. We'll be right back on Better Living. We are back at Faces, and we are here with Angie now, and we're going to talk about skincare, because that's really where it all starts.
It's where it all starts.
Doesn't matter if you're doing fillers or doing something else. If you are not taking care of your skin, then that's a problem. So you guys have the GRASS method. Tell me what the letters in GRASS stand for.
Yes. So GRASS is an acronym that we use that helps people to know really what we think the staples in your skincare regimen should be. They're the tried and true. They've been around the longest. We know they have a lot of research to support their claims. They're growth factors, retinols or retinoids of some sort, antioxidants, topically, all of this is topical, sunscreen, and specialty ingredients kind of come into play as that second S when we have some special needs that we need to address.
And the sunscreen is so very important. I may not do a really good job of the other things because I'm kind of lazy, but I am really good with the sunscreen.
Yes, sunscreen is definitely the most important, the #1 anti-aging product, obviously, that people can use, and something they should really get into the habit of using every single day. And I say all the time, if we taught our kids to wear sunscreen like we teach them to brush their teeth, we would see a much lower incidence of skin cancers.
And it would be so easy. I guess that's what's so frustrating, is that it's so easy to make them put on sunscreen. And for ourselves too. And that's just it. We can get products with the sunscreen in it.
Yeah, so there are products with sunscreen in it. I will tell you, I am a fan of layering your sunscreen over your moisturizer. I know they are available in moisturizers, but they tend to break down a little bit faster. They also tend to use more chemical sunscreen ingredients in moisturizers, so they're not as good for your skin, or you don't always get the best sun protection with them. So finding a nice sunscreen that you can layer over your moisturizer is always a better choice.
Well, if I'm using, I would assume, and maybe not, but that I need a different sunscreen for my face, a different type than I do for my body.
Right. Yes. In fact, a lot of the body sunscreens are not as cosmetically elegant. Where the face sunscreens now, we have tinted formulations, we have oil-free formulations, just about for any skin type, so that we can find a sunscreen that is appealing to you to use every day, and not like the old sunscreens, which were not very cosmetically appealing at all.
Let's talk about Skin Medica. That is the line that you guys carry here.
Yes, so Skin Medica is a physician-only skincare line. It is actually one of the top skincare lines in the medical channel, and they are really, really well known for the research and the amount of time that they really put into formulating these products before they actually bring them to market. Their growth factors are something that have really put them on the map. And the growth factors are a newer ingredient in skincare. They've been around about 15 years, but they really have the ability to reduce inflammation in the skin, which is like the root of all aging, and really increase new healthy cell growth and increase collagen production. So that's kind of their flagship product, their product that really sets them apart from everyone else in the industry.
Now, if I come here to face as skin health experts, you guys can help me. First, I can come and have you will put them on for me. I can do a facial.
Absolutely, you can do a facial. We really specialize in corrective skincare. That's our approach. We really are about results and creating change for people. We do facials. We don't do a ton of facials because people are here for results.
Right.
So we put together like a comprehensive program that's easy for you, that's affordable for you, that fits into your lifestyle, your budget, and it incorporates your home care as well as whatever treatment plan we come up with you for here, depending on what your needs are.
Well, and that's what I was going to say. If I want to just come in and get the Skin Medica line, you're going to walk me through everything that I need to do.
And Skin Medica backs up their products 100%. So if for some reason something isn't working for you, you can bring it back and we'll swap out and find something that does. But the most important thing is that we're all trained in skincare. We aren't just salespeople.
Right.
We know what these products are. We've worked with them for a long time, and we want to work with you to really figure out, to develop a relationship and figure out what works best for you. So you don't feel like you're constantly purchasing things all over the place, because that's what women do. We're looking for the next best thing, right? And then we end up with thousands of dollars of skincare products that are tossed in our drawers that we're not using. So we really try to work with you to find what's best for your lifestyle, to try to really save you money in the long run, because you're not jumping all over the place then.
I love that you're the experts. Look, I know television. I don't know skincare. And so if you help me, then perhaps I wouldn't be so lazy and I could get it done. I definitely want to touch on, though, something else that you do here, and that is permanent makeup.
Yeah, so permanent makeup, it's funny. I've been doing it for about 13 years. I do lots of it. There's two of us here who do it. We do on average about 2 procedures a day. Wow. But it's really funny. And I've been doing 2 procedures a day for 13 years.
I would have had no idea.
I know. It's like somehow a secret. Like people don't realize that this is available.
Well, you know what I think part of the reason it's a secret is that you really can't tell it's permanent makeup.
True.
I'm not going to notice that my friend has permanent eyeliner.
You shouldn't anyways.
No.
If it's done properly and if it's done by someone who's certified, who has the right skill, who has the right equipment and the right products, then it should be very, very natural, and it should really be a convenience for you. Right. We call it wake up with makeup.
I love it.
So you don't have to get up. If it's the weekend and you want to just get up, throw a little mascara on and go, you can do that.
That's great. So you can do eyebrows and eyeliner and lip liner.
Yep.
Am I missing anything?
Eyebrows, eyeliner, lips, we can either do it as a liner procedure or a full lip. I prefer to do a full lip procedure. We do some camouflaging for people with scars, things like that. We do some tattooing for reconstructive breast cancer patients. We do that. So really, we can address a lot of different issues, not always just cosmetic issues, although that's the most popular.
Well, I think that's a consultation we all need to have for sure. I want to just wake up with makeup. We'll be right back.